When I was in third year and preparing for my step 1, I used to have problem in identifying these images, which I will read out to you in the next 1 minute. ARMD is basically a disease in which there is degeneration of the macula, which is the central area of the retina. If you imagine your retina like this, it has a central region called the macula. Now, there will be degeneration in this area which will cause distortion, which is metamorphopsia, and eventual loss of central vision, which is scotoma. Metamorphopsia is um, the problem in visibility which causes lines, straight lines like the ones I've drawn, to look like this or maybe this. So basically you have some problem in the macula which is causing it to appear distorted. This grid that I am drawing subsequently is also known as Amsler grid, and the test is known as Amsler grid test. Now, ARMD could be of dry type or it could be of wet type. This degeneration could be because of deposits behind the macula or because of blood vessels. When it is because of deposits, it is dry. When it is because of blood vessels, it is wet. The dry deposits that are found behind the macula are known as drusen, and they are found between Bruch's membrane and RPE. They prevent You can prevent the progression with multivitamin and antioxidant supplements. Now in dry, you are having chronic oxidative damage, and it is the most common cause of blindness in in people in US over 50 years of age. Genetically predisposed individuals with factors with environmental factors like smoking. So you see them in genetically predisposed individuals with environmental factors like smoking. Also, if it is of the wet type, you will have neovascularization, so anti-VEGF agents can be used. For example, ranibizumab. There is an increasing trend to ask these antibodies, so ask these factors, and the questions on these antibodies are a new trend. You can also use bevacizumab or ranibizumab. Now, so I've also written that metamorphopsia is distortion of straight lines, as I've shown you here by the Amsler grid test, which is different from Amsler grid sign, and we are not going into Amsler grid sign right now. You can see that there is a deposition, white granular deposition, cluttered more around an area which you can very well imagine would be the macula, and this is known as dry ARMD. Now in diabetic retinopathy, what we have is retinal damage due to chronic hypoglycemia. There are two types of retinal damage that can be caused by hyperglycemia: proliferative or non-proliferative. Proliferative is chronic hypoxia, which is leading to new blood vessel formation. And you will just treat it by retinal photocoagulation or anti-VEGF agents. But non-proliferative is when there is a damage in the already present blood vessels. Rather than the formation of new blood vessels, you have damage in the already present blood vessels, causing lipids and fluid to seep into the retina and cause hemorrhages as shown with blue arrows in A. So how do you identify a hemorrhage? A hemorrhage is basically increased redness in the image of the retina. So you can see, I don't know if you can appreciate it that well, but I certainly can. There is increased redness in this area that I would call as a hemorrhage. So, in the non-proliferative type, you can only control the blood sugar. In the proliferative type, again, you can use anti-VEGF agents or you can do photocoagulation. Glucose undergoes glycolysis, but if it is more in amount, it would be converted to sorbitol by aldose reductase, and then sorbitol dehydrogenase would convert it to fructose. Now, if a cell is not able to regulate the glucose influx, um, there'll be increased accumulation of these two intermediates in cells which cannot control glucose influx, like the endothelial cell, the retinal blood vessels, lens, the cells of the lens, renal mesangial cells. You also have Kimmelstein Wilson lesions because of the same, the Schwann cells. Now, retinal vein occlusion. So, as far as I remember, it is GLUT4 which is not insulin regulated. You can correct me in the comments if I'm wrong. Um, GLUT4 is found in the adipose tissue and in the muscles. So these two areas, I think they don't require regulated influx. I don't know, let's not go into that. I'll read up and tell you more about it. Retinal, I don't know why I'm getting confused over it. I'll read up and tell you. Blockage of central or branch retinal vein due to compression. So, retinal vein occlusion is basically compression of. Now, retinal vein occlusion, um, it could be the blockage of a central vein or a branch of a retinal vein due to compression by nearby arterial atherosclerosis. So basically, a vein is getting compressed due to atherosclerosis, most commonly in a artery. Now, if suppose, let's say there was an artery here which is compressing the vein behind it, that vein will show hemorrhage and engorgement. Engorgement, again, as I told you, any blood spill or any blood can be made out by increase in the redness. Um, and maybe this is edema because it's not in the outline of a vessel. Retinal detachment is separation of neurosensory layer of retina from the outermost pigment epithelium. So, secondary to retinal breaks, diabetic traction, inflammatory fusion, crinkling. Basically, what you're seeing here is that this particular portion got detached. As it got detached, the redness behind it decreased because the blood vessels are not in close proximity to it now. It has got detached from the choroid. This retina is detached from the blood vessels behind it, so it is appearing less red in color. These are seen in patients with high myopia or head trauma patients. There can be posterior vitreous detachment appearing as flashes or floaters, and eventually there will be a monoocular loss of vision. One eye will show loss of vision like a curtain has been drawn down. It's a surgical emergency. Open angle glaucoma will show optic disc cupping. There will be transient monoocular vision loss, most commonly due to carotid. In retinal ischemia, there will be painless transient monoocular vision loss, which is also called as emeroxis fugax, when it is due to a carotid artery emboli. Thank you.